little awkwardly beginning.
Thank you for joining us today. My name is Brett Chenot. I've worked as a team assistant in the home and community care health sector in Ottawa and Eastern Ontario for more than 13 years. With me today is Maxime Lang, a team assistant with the Mississauga-Halton Ontario Health at Home, and Lorna Shipley, a team assistant with the Central East Ontario Health at Home. Across the province, CUPE, the Canadian Union of Public Employees, represent over 1,700 staff at Ontario Health at Home. Our roles are diverse, and they include the following: care coordinators, team assistant educators, information technology specialists, administrative assistants, care connectors, finance workers, scheduling professionals, communication specialists, direct care providers, educators, facility workers, risk management analysis, health records workers, quality analysis, decision support analysis. Unfortunately, a QP care coordinator cannot join us here at Queen's Park today. We are here because we want to talk with you about the impacts of the most recent home healthcare restructuring by the Ford government. It's a mess. Patient, home care, and Ontario Health at Home workers are paying the price. We just wish Doug Ford and the PCs were as focused on home healthcare as he is on calling a new election. To illustrate the problems the Ford government has created in home care, we are releasing the first of its kind, a recent survey of Ontario Health at Home workers represented by QP. Home care has been in trouble ever since the last PC government restructuring and privatized much of it. Ontario is now on our fourth home care restructuring since that time. None of these attempts have ended the basic problems that come with compulsory contracting out, low wages, bad working conditions, high staff turnover, and staffing shortages. The latest restructuring in Ontario Health at Home is creating even more problems. Our survey findings point to the health system restructuring that is failing to reduce gaps in care and deepening health service privatization. All these factors are further demoralizing staff who are dealing with increasing workloads and mounting concerns of losing their job. Taken as a whole, the survey gives insight into the now all too frequent stories from patients and their families about medication, supply, and staffing shortages plaguing the home and community care sector. Overall, 1,052 respondents completed the survey, and hundreds took the time to write in thousands of comments about how the system changes are impacting them at work and in their lives. Respondents report very significant frustrations with the ongoing restructuring and the uncertainty it is creating. Workplace stress, anger, overwork, and belief that they just are not being told the full story were frequent themes. A recurring theme among those who had worked in the field for years was that they never seen things this bad in the sector. The survey findings include the following: 74% say workload has increased since the merger into Ontario Health at Home. A very high percentage of respondents, 84%, are concerned about whether they will have a job in the future. 62% identify staff retention as a problem. 65% say that they are concerned about increasing privatization. What is clear is that many of the front lines are frustrated by the endless changes, secrecy, and increasing workload. They feel undervalued and upset. Constantly, we are learning new processes that get changed the next month, so it is very difficult to keep pace with the changes and what managers are telling us what they actually want done. The impact on both patients' care and Ontario Health at Home staff is adverse, not what the government wants Ontarians to believe. Issues cited in the survey include work being taken over by the Contracted Service Provider Organization, also known as SPOs. SPOs are usually for-profit corporations. Other mention the growing role of hospitals, which are themselves struggling to provide adequate patient care due to severe underfunding. The lack of information from Ontario Health at Home about future restructuring plan is often mentioned, despite management and government's talk about transparency. Many say the Ford government is committed to healthcare privatization and they fear the loss of their jobs. Maxine will now elaborate on some of the comments we received from the survey, and in particular, the apprehension and changing role of care coordinators.
Thank you. Good morning. Hello, my name is Maxine Lane. I've worked in the at-home and community care sector for more than 3 decades. It is important to stress that the work that we at Ontario Health at home do is very, very important part of the health system to ensure patients gets the care they need at home in our community. It's a role that is not visible as those care for Ontario patients at home and making sure you get the care you need and deserve in your home. As Brett mentioned, 84% of the survey respondents are concerned about whether they have a job in the future. Here are a few comments respondents provided on why their work future is uncertain. The way the employees are being treated would never be tolerated in a male-dominated workforce. It is shameful. The lack of concern for the mental health of our employees has been completely disregarded with such uncertainty, lack of information, and the creation of work expectations that are unnecessary, discriminatory, and unsafe in general. There's no consultation with the employees, there is no actual sharing of information, and we have been expected to put our lives on hold for 4 years, while the merger goes forward and we are kept in the dark. Town hall meetings are insulting and tone deaf, speaking about things which are in no way a priority for people who don't know the basic answer to the question we have. Will I have a job? And what will that look like? The government seems hell-bent on privatizing the healthcare system. Anyone who has been paying the slightest attention will have this concern. Providers are taking over everything. We are now considered a service provider.
That's
and
wrong.
Hospitals and SPOs are now offering bundled care, which they are managing. The Ontario health teams are creating different programs, bundled care, hiring navigators, whose roles is similar to care coordinators. Ontario health teams are also directed sending these referrals to the service provider agencies, eliminating the role and utilization of Ontario Health at Home care coordination services. It feels as if there are many more changes planned and management is not telling us about. I do not trust management. I am worried that they will have other people maintaining the waitlist for long-term care homes. There has been no reassurance from discussions for job security for our team assistants. Referrals are going directly to hospitals, bypassing Ontario Health at Home. Palliative care teams are moving into hospitals. We also want to stress how the role of the care coordinators is changing and how workload is increasing. The number of at-home visits for patients is increasing with the number of care coordinators. We currently have to sadly we have to triage patient care needs, which leaves some patients with weeks-long gaps for their at-home care. Hospitals are working from different digital programs than we do.
Wow.
Hi, I'm Lorna Shipley. I've been a team assistant at the Ontario Health at Home Central East for 25 years. Here are
25 years.
some takeaway comments from the surveys from our staff. Leadership have not communicated what our roles, place of employment, etc. will look like. Cryptic messaging, last minute rollouts, and then denying changes. Questions not answered in town halls. This merger has been implemented, has caused serious distress to all employees, patients, physicians, and service providers. The timelines for rollouts increased workload over the summer leading into this disastrous fall have made Ontario Health at Home and its employees look completely incompetent to deliver effective care in the home. Another comment was, since I've been working here for 16 and a half years, this has been the most challenging by far. We also do not get proper training, very little support from management, thrown to the wolves. Many staff are making choice to leave because they need more security than we have. Increased demands on staff are pushing people to retire earlier than planned. So much cross coverage and short staffing in a consistent way. It's really rare to only have you to do your own job. New employees don't realize how much work they have signed on for. By the time the probation is ended, they have found positions elsewhere. This job has become very overwhelming and is not possible to be successful in this turn. It turns them off the job. People are not happy, overworked, no flexibility, favoritism. People are very frustrated with changes and secrecy. The recent changes in medical equipment and supplies to a common service organization and single formula clearly was a disaster and not thought out well. Did upper management consult with frontline workers to assess how this change will impact services and patient care? It doesn't seem so. Many changes too fast without due diligence to ensure the changes work well. The pay inequalities between branches is really upsetting. One of the last comments was, I have been working here for 24 years and have never felt so stressed and overworked has impacted my health. Thank you for joining us today, and we are able to answer any questions.
At least the media showed up.
In terms of the increased workload and the overwhelming amount of work that
where's all the other media?
Is this an issue of staff retention primarily, or is it the structure of how
I think it's both. There's a lot of positions that are not covered. I think they're having trouble finding qualified staff. And also, I mean, we all know that the population is aging. I'm in the Central East area, so, Durham region, and that is really increased over the years.
And we heard a lot about the problems with home care and not getting the supplies. Like, how much is this connected to those issues?
100%.
I can speak to that. I do work in Central Oregon, and I've been doing medical supplies and equipment for over 20 years. This recent change of vendors, like Lorna stated before, it wasn't frontline staff. We weren't included in the process. We weren't told about it. We just knew that we're switching vendors once more. And every day that I order supplies, it's a frustration because everything is out of stock. So our patients aren't getting the supplies that they do require for their care. So that change has been with the restructuring that happened with the new vendors. And
thank you, Doug.
It was a disaster. And it still continues to be with
now he
the
wants to
providers
steal an election with
the
Elon
demands
Musk's
of our clients.
bullshit.
And everything, all the supplies, out of stock every day.
So you're saying it continues. What kinds of things are still out of stock?
Everything.
Just basic medical supplies, IV supplies, needles, catheter supplies, basic kits, wound care kits. Every time they're entered, it comes up out of stock.
Wow.
How does that impact the care that you're trying to provide?
You can't provide it without
Well, huge. It looked, because then what's happening now, it's increased our nursing visits. So if the supplies aren't there and there's a scheduled visit, the nurse has to go back in. So that's another added cost.
But just to add that, so if you're looking at, if you're talking about IV supplies, then it's not being able to be done in the home. So they are going back to Emerge to get that. So Ontario Health at Home, one of our mandates, kind of what we're supposed to be doing is keeping people out of hospitals, keeping them at home. These people are going back to Emerge, waiting 3, 4, 5 hours just to get their dosage, which could have been done at the home if the supplies were in.
So is there any improvement since fall when this was really brought up as an issue?
Nope.
I feel in our area there has been a change. I'm not in that direct area that sees the issues, but I don't know. You guys are in different areas.
As Lorna, just recently they're changing the southeast over to one provider. They're kind of like what they did. They did it in steps through different regions. So they're starting with her region shortly, Central East. So that is going to just cause the same disruption as the rest. It's one service provider dealing with all of Ontario, where before it was sectioned off into regions, and they just can't keep up with the demand.
So there could be more supply issues in another part of the province still.
Yeah.
Correct. As they roll it out.
Well, yeah. So they started out with like IVs. They started out with IV supplies, things like that. Now it's starting for equipment. So different supplies. So when we're talking about equipment, we're talking about hospital beds, commodes,
Everything.
Everything that to keep our
Your patients.
residents safe.
Mhm.
Like,
What would be your message to the province on that issue?
I would say just use a vendor that can keep up with the demand. I'm concerned about the upcoming medical supplies. It hasn't hit my area yet, the equipment, sorry, but we're talking hospital beds, select air mattresses, and if it's out of stock, how can we do that safe discharge from hospital to home if there's no equipment? So we don't know yet about the
Fucking us all.
equipment piece, if it's going to be the same as the
I hate
medical
Doug Ford.
piece, but hopefully not, because equipment's more crucial.
They're
in
trying
my
to just
opinion,
destroy our
than
healthcare,
trying to get
folks.
discharges from the hospital to home.
From many different ways.
And these issues, they're across the board from all suppliers.
Yes.
Why did you guys want to do this, come out with this release and talk about your
To get people
findings
aware,
on
they
this
probably.
survey?
To
Do
put
it in
pressure
this
on the
way.
government this way.
What are you trying to achieve?
We just wanted to make the public, mainly public awareness. A lot of people don't know what Ontario Health at Home is or does, and the government is so secret about what the changes they're doing. They're secretive even with myself and the members and the workers. So it's just about community knowledge and getting our name out there, and
Letting things be
hopefully the
known.
public will take action and go to their MPPs and
Demand
fight
better.
against
Yeah.
privatization of healthcare.
Please, people, help us. Help people
And just to add to
fight
that,
this. We want public
just to make sure our
health,
patients,
like
our
universal
clients
health
that we
care.
do serve,
I don't
are
want
being
American style.
served appropriately. If we're Ontario Health at Home, we have to set up the services, the care at home. That that includes their a good care for their supplies, their nursing visits, their equipment, so we can
Do your
service
jobs.
them in their home. But without that, and Brett's right, the general public has no idea.
Yep.
Like
Because
I've gone through so many mergers, and it's this one here feels a little different. With with the change in the vendors and so forth. So I'm just concerned that our patients are not getting the care that they deserve in their home.
And these are patients who in some cases are palliative, they have serious conditions. Like, what do you think in the end does it mean for them
it means death, possibly.
with these
For
problems?
the patients, you say?
Like, what are we talking about here?
I mean, we're talking about the elderly. We're talking, like in my sector, we do children's services as well. I don't know. I just want this whole thing to, to be figured out appropriately. I think they need to include frontline staff more, because we're the users. We know them making decisions and not informing us. It's bad because we don't know, and we're kept in the dark, like Brett referred to. Yeah.
So just to add to that, I think most people would like to stay in their homes as long as they can instead of going into hospitals. We know that the hospital situation is not good as well. There's no room for them. So to have the care at home and have these families with with their loved ones,
Definitely wants us to
and
be
to
American.
have their dignity of living in their own home. I think that's a message we want to get out to the public, is that we're here, we want to help, and it's failing the public right now, and we need to improve it.
The government is. I hate the
Do any
cardboard
of
government.
you work? I'm not sorry. Looking at your job titles, I'm not totally clear. Do you go out to the homes? Any of you?
No, unfortunately, we the care coordinators are the ones that go out to the home, and we couldn't have one that joined us.
But I can speak to that because my sector has care coordination, so they do home visits and they do the care planning. Since the fall, the expectation is that they do more
With
visits,
less.
more visits, get out more.
It's all about
So
making the
we
money.
have care coordination in my sector, Mississauga Halton, and the GTA.
And what are they hearing as a result of these changes from the families?
People aren't getting the proper
They're
care.
the same. Again, their hands are tied too, because of the service they can offer, right? And they're just saying. I mean, it's very difficult for them when they do the RI assessments or the long-term care applications, to say, Mrs. Smith, you're only getting one bath a week, or you're only getting an hour, once a week. So it's quite difficult for them as well to coordinate services right now.
Also, I
Just
realize
the weasels in there.
frustration with a lot of the care coordinators because, like as Maxine said, they do the assessments, they do the RISE, and say Mrs. Smith, it qualifies for a certain amount of shift nursing or PSW. Then they put that out to the providers to pick up as a contract, and nobody picks it up. So then you got to go back to Miss Smith and say, I'm sorry, you do qualify for all these services, but they can't. There's nobody to take care of you. So back to the hospital they go. So that is very frustrating. It's also very frustrating when nurses show up and there's no supplies in the home, and the patients are being told to go and purchase the supplies themselves and then submit to Ontario Health for reimbursement.
Yeah, that's what the Ontario. That's what
just
the.
not appropriate. I've
That's
been
what the health
around for
minister
13
said.
years and I've never seen shift nursing be on a wait list. Shift nursing is there for overnights, for medication purposes, for dying people. People want to die with dignity. They want to be as comfortable as possible, and the changes that are being made and the decisions that are being made are just not
Adequate.
not holding up to that standard.
I'm thinking back to the last election campaign when there was a lot of talk about home care and spending more money.
Mm-hmm.
It sounds like from you this hasn't resulted in any positive changes.
Yeah, no, that's just them wasting our funds.
The part of it is the service providers are for profit. They're even having trouble retaining staff for wages. That's another topic. But if we put out something for 24 hours a week, these people are not leaving hospital because we can't secure 24 hours a week for them at home. So it's even a broader issue than just the Ontario Health at Home piece. But the service providers don't have the people that want to work, and probably low wages, everything else. So it's a whole
Mess.
bigger issue as well.
Just want to ask for a point of clarification on something you said. The province is currently changing suppliers for equipment. It's just going to be one supplier across
For the
board.
whole province.
Every region had their own supplies and equipment providers, and since we became one agency, the government decided to make one overall seeing agency for supplies and equipment, and it's just since day one it has not worked.
And they're not changing
And so
it.
we'd heard about a company for supplies, so it's going to be the very same company
Yes.
for equipment.
And not the same company, but the same model.
When you say the same model, what do you mean by
Like
that?
the same structure across Ontario, whereas some different regions kind of did their own kind of thing, like they had their own rules. In Toronto, in London, in Cornwall, it was all done kind of differently. So now it's being streamlined, but they just can't keep up with the demand.
I was gonna say, I guess, I was gonna ask what the risks are of that, and I guess that
The risks are exactly what are happening.
Yeah.
And one of the jobs of Ontario Health at Home as well is keeping these providers, holding them accountable, right? They have contracts with us, and we keep them accountable for public safety, to minimize risk. And it's just as they get more private and further away, there's just less accountability.
There you go. That's what private healthcare
Brett,
is.
were you going to talk about funding for the health system generally and the impact on this piece? So, sorry, I didn't mean to interrupt. I think Lorinda was getting to what is the disconnect in the health system, and how is it tied to underfunding of home care, really? Or did I misread that, Lorinda?
I don't know, I'm fine.
That's it.
Thank you, guys.